I'm so excited to have with me today Dr. Thomas Sheldon. Tom is one of our oboe players in the Longwood Symphony and was previously our board chair and currently still on the board as a member of the board of directors. Thanks for joining us, Tom.
Thank you for having me.
So Tom, tell us a little bit about yourself, who you are and what you do.
Well, so my name's Tom Sheldon. I have a day job that's in medicine like many people in the Longwood Symphony. I'm a radiation oncologist. I trained at the Harvard Medical Area. And what's interesting is at the time the Longwood Symphony started in the mid-'80s, I was actually on the faculty at Dana-Farber Cancer Institute and the New England Deaconess Hospital and didn't even know it existed. After a few years on faculty, I left and came to New Hampshire and have had a very good practice up here. I manage the practice. We have 19 doctors in our practice, and we run 7 sites, including the Leahy Clinic and Lowell General in Massachusetts, and then 5 other sites in New Hampshire. So we have a very large radiation oncology practice that I am the president of and manage, and that takes a fair amount of my time these days. What happened to me, I grew up playing music, and everybody in my family played instruments. My 2 older brothers had both been in rock and roll bands, one of which was very successful and one of which was moderately successful. And my dad, when I was small, was playing flute in the Waukesha Symphony, which was the precursor to the Milwaukee Symphony. And so a lot of music in my family. I started out on the piccolo when I was in about 2nd grade. I think I'd started on the piano before that, and maybe 3rd grade. And then one day I was in about 5th grade. My dad came home and said, "I got a good deal on a used oboe. Who wants to play the oboe?" And at that point, I was so sick of the piccolo, I couldn't tell you. And so I said, I do. And so that's how I started playing the oboe. And I took lessons. I played through high school and then through college at the University of Wisconsin, and then really gave it up for about 25 years. Did nothing, didn't even take it out of the case. And when one of my sons was interested in playing, so I said, great, we'll take lessons together. I was in my late 40s at that point. And so we took lessons together. He played through high school, through prep school, and I then just adored it. I had forgotten how much I loved it, and I just kept playing. And, I was playing in some chamber groups. I was doing the Wellesley Composers Conference in the summer. And then one day I was reading a physician lifestyle magazine. And actually I wasn't reading it. I was just literally tossing it into the trash like all the other throwaway mail I was getting. And on the cover was doctors who play music. And as I flew into the trash, I saw the cover of it. And so I pulled it back out of the trash, and it was all about the different musical things, including the Longwood Symphony. And so I called Jonathan McPhee, who had just started as the conductor, and said, I don't know if you need any oboes, but I'm very interested. And so I went down and auditioned. It was at the old Opera House in Boston. We went down in the pit. I'll never forget this. And I could hear the squeaking shoes of the ballet dancers on stage. And I was auditioning for Jonathan. And he took me. I was still pretty rough back then, but he took me. And I've been in the orchestra since I think 2004, 2005 series.
So you've come a pretty long way from playing piccolo in 2nd grade to now being in the Longwood Symphony.
Yeah.
Well, I can definitely understand and commiserate since I'm also an oboe player.
Right, I know.
I have to know, do you make your own reeds?
I do. Lately, for the last year and a half or 2 years, I've actually been buying reeds. And I have everything. I have, the stuff literally to start with tube cane and do it all the way through. And that's what I did for most of my career. When I became president of my practice, and particularly when I was chairman of the board, we lost our executive director at that time. And so I just had no time. I have 4 children. I have a busy practice. I'm president of my practice. I'm playing music, and I just had no time to make reeds. And so that's when I started buying some reeds. And so I use a combination of reeds that I've made and somebody else makes now. But for most of my career, I've certainly made my own reeds. Yeah.
That's impressive. It is probably takes as much, if not more time than practicing.
Yeah, and something had to go, and that's what went. Yeah.
So tell us a little bit more about your radiation oncology practice.
So radiation oncology, oncology is really divided into three areas. Medical oncology, they give the chemotherapy and some of the newer targeted therapies we all hear about on TV. Radiation oncology, all we do is the radiation part of cancer treatment. And then there's surgical oncology, of course. There's specialized surgeons now that take care of colon cancer, breast cancer. These are often fellowship trained, very skilled surgeons that are helping us as well. Radiation oncology, when I went into it, I started in 1981, and it was very primitive then compared to what it is now. And I could see the possibilities, but I'll tell you, a lot of my advisors when I was a medical student and intern thought I was crazy. They said, "You're going to go into radiation oncology?" They wanted me to go into cardiology, and they just thought, what a ridiculous field. But I knew that the imaging technology and the computer technology and the beam technology would advance the field tremendously, and thankfully I was right. That's just what's happened. And so during my career, I've seen an incredible explosion of technology and our ability to treat cancer with radiation safely and effectively. Many of the things that we started when I was at Harvard and before was, treating breast cancer with lumpectomy instead of mastectomy. And that was really developed in this country by my boss at the time at Harvard. But
Can you
now,
describe what the difference is between those two?
So a mastectomy is where you remove the whole breast, and the lumpectomy is where you simply take out the tumor, you take out some lymph nodes, and then you treat the breast with radiation. And that provides cure rates that are equivalent to surgery. And we've done big randomized trials where one of the biggest trials, 2,000 women either had one of the two treatments, and now at 30 years later, the cure rate is identical. There's no difference. And so we can tell people with a lot of assurance that they don't need a mastectomy. It's now become the same with prostate cancer. When I started in the field, our ability to treat prostate cancer was not as good as the surgeons. And so radical prostatectomy was still a better treatment. Radiation is now quite equivalent. And that's one of my areas of specialty. And so either I give external radiation, which is about 7 to 9 weeks of daily radiation, or I actually surgically implant radioactive seeds into people's prostates. I'm one of the few people that's in New Hampshire that does that as a specialty, and that provides results that are absolutely equivalent to surgery. A lot of what we do in radiation oncology is offer alternatives to surgery, which is less invasive and provides better function. Sometimes we also add to surgery. So a classic example might be, let's say, rectal cancer, where we'll give a course of radiation for about 5 weeks prior to surgery, and then they'll go ahead and have surgery, and the cure rate is much higher than just the surgery alone. So we kind of do those two things. The final thing we do as a big portion of our treatment is what's called palliative radiation. So patients with, let's say, a painful spot in their bones, and these are cancers that we can't cure, but they have terrible quality of life problems from their cancer. Radiation is often the best treatment for that sort of thing. And if somebody has, back pain from cancer in their bones, 10 radiation treatments or 5 radiation treatments typically within 2 weeks takes the pain away 100%, and often with virtually no side effects. And so it's truly one of the miraculous things that we can do for people and really improve their quality of life. So that's, even though we can't cure those people, it's one of the really fulfilling and exciting things we do in our field.
That's really incredible. And I'm sure all of that has changed now during the current pandemic due to the coronavirus. So with all of your, you have multiple branches and locations for your practice. How has that changed? How are you guys adapting to all of this?
Right. So from one of the things I get involved in is the doctor staffing. And what we do is there's only one doctor on each site every day. We don't have any meetings together because literally if one of us got sick and sickened the others, there would be no radiation oncologists for most of New Hampshire. And so we do all of our meetings remotely. We've set up very stringent criteria when somebody comes into our department for their daily treatment. Every day they're handed a mask, their temperature is checked. They're not allowed to bring any visitors in with them. The big thing is we've created a set of contingency plans for if a patient has COVID, is sick, but still needs to be treated. There are some kinds of radiation treatment for cancer that are very time sensitive, and you can't just give somebody 14 days off to recover. And so we have to have the protective equipment. We have to be able to sanitize the treatment room afterwards and all of that. And thankfully, we haven't had any patients that we've had to treat who've been COVID positive. But we have to be ready for that sort of thing. The final thing that we're very concerned with is that many of our patients who are getting chemo and radiation together are significantly immunosuppressed. And if they were to get COVID, it would probably be fatal, very likely be fatal. And so our responsibility to protect our patients is higher than almost anybody in medicine. And so we've had a lot of very careful considerations. We're not running any of our routine follow-up clinics. And we're not sure when we're going to open them yet. Some of it will probably depend on taking the lead from our hospitals. So hospitals in Massachusetts, where there are a lot more COVID cases, we will probably be later in opening these clinics. In New Hampshire, we've been very fortunate. People have quarantined. Our case numbers have been low. At my hospital, Concord Hospital, our inpatient volume has always been in the single digits. And so as a result, I think we'll be quicker to be able to open our doors for routine care again. But I will tell you, as somebody that practices a very high technology medicine, it is very challenging to do it from a distance. And I'm constantly on the phone with radiologists and other specialists to make sure that everything is covered for these patients. And we put in these very careful systems to make sure that everything is done properly, that nothing could get missed. And, and in doing that, deliver a high level of care. And this is very worrisome to me. I mean, and we haven't had any problems, but, the chance of something getting missed, some kind of error being made is much higher than it usually is when we're not in this crisis. So I've spent a lot of my time and just my mental energies making sure that everything is safe for the staff and for the patients.
I can only imagine that your stress levels have probably been higher than,
right.
Than usual. What are you doing to kind of stay mentally healthy and take care of yourself?
Yeah, well, one of the nice things is working remotely. I'm trying to eat less, and I take the dog for walks and go for walks with my wife and try to stay physically healthy. I don't, for a while, I had kind of stopped playing regularly because I have nothing to prepare for. As you know, our concerts are off for now, but I'm definitely back to practicing. I don't have a teacher right now. I don't have time for it, but I'm very methodical about my own lesson plans. And so I have a series of exercises, some limited repertoire with certain challenges, and then that I practice every day or every other day. And then I've got some books of Bach that I just read, and just reading Bach and playing Bach, as you know, is that in long tones is the mother's milk of being a good musician. So, I'm continuing to do that, and that's as good for my mental health as anything.
Yeah, music is healing in many ways.
Yeah.
So do you find that there are any parallels between what you do musically and what you do medically?
Oh, I can't even begin to tell you. Some of the things I've learned from music have helped me in medical communication. When it's a concert, when we're giving a concert, we're communicating. And so a classic example is in music, especially classical music. some of the most poignant moments are in silence or near silence. And those are beautiful moments. And when I'm talking to patients and families, one of the things I've learned to do that many doctors have trouble doing is respect the silences. And so when there's a moment when we've discussed something and it's kind of sinking in with everybody, I don't rush in to interrupt that. And learning, that sort of cadence, which is a musical term of how to run a consultation or some kind of counseling session, has been incredibly valuable. And there are lots of communication skills like that I think are very useful. The other thing I think is just training in music from a very young age, I think is very good for your mind. I was always a natural at mathematics and science and things like that. And I think, a lot of that came from musical training. And I find that in particular memory is preserved in an old man such as myself by playing music. And my memory, I've hired, of the 19 doctors in my practice, I have hired 18 of them. I'm the oldest guy. And I can tell you that I've worked with a lot of these are superb young physicians. But I can tell you that my memory is as good as theirs. And it really relates to playing music. I can guarantee that if I didn't play music, I would not be able to say that. And so I think just in terms of preserving, and there's lots of studies that suggest that, but preserving kind of the older mind, it's a fantastic thing.
That's wonderful. I'm glad that you see music as a way to really make your whole self what it is.
Yeah, and what I've said is just really a small portion of that, how I feel that way.
We'll have to dig into your brain further and find out more about it sometime. Do you have any other final thoughts or things you want to add before we let you go?
No, I just would encourage everyone to stay safe. I think we're very lucky here in New Hampshire that we've been careful to quarantine early and we have a low density population. But I think that we've learned from cities that opened up too soon that their cases almost immediately spiked. And I would just encourage everybody to be very cautious, to make sure that they if they have friends who have chronic diseases such as chronic obstructive pulmonary disease, cancer, other things, that they respect the vulnerabilities of their friends and try to kind of make sure they quarantine. I would say, and the main thing I would just say is stay safe. But I would say, when we ultimately are able to move out of this, please come back to the Longwood Symphony. One of the things I feel very strongly is that a Longwood concert is a different experience than a Boston Symphony concert. And we don't try to say that we have their level of skill, but I think the way you will feel walking out of our concert is different. I think you have people who are playing from the heart and not all from the mind. I think that the fact that we have important charities and who many of the people in the audience will be with them will give you a different feeling that you're participating in a charity event. I just think they're wonderful events that I would encourage everybody to come back to after this COVID crisis is over.
Well, I might be biased, but I agree.
And you are biased, but I'll still take it.
Well, thank you so much, Tom. It's, of course, always a pleasure to talk to another oboist, but equally a pleasure to speak with you. So I appreciate you taking time to do this.
Happy to do it. You take care.